I'm going to show you how I treat a neck problem. So basically, I check for the range of motion. I've already done the examination to see if I can really help this patient, or if she needs x-rays or MRI. I've already reviewed that, and she doesn't need that at this time. So I want you to turn your head to the right, and we're going to just check out her range of motion, and then turn all the way to the left, and you're going to point to where you have the pain. Okay, good. So now I'm going to come back and feel the area. And what am I feeling for? I'm feeling for how the joints move and how they're restricted, and any little muscle spasm that I can pinpoint and find, like right there. So I gently turn her head away, and I'm going to actually grab one of the Graston tools and gently work the muscles and the fascia so that we can lift it up and lengthen the fibers so that the joints can move more freely as they're meant to. So we do that for a little while, and then we'll check the range of motion again. So let's have you come to the center and turn your head to the right and then to the left, and then tell me if that feels even a little bit better.
Yes.
Very good. Okay, good. So now I'm going to show you how I'm going to stretch the trapezius muscles, which they do start up here on the occiput and go all the way down here and then to the middle of the back. So you're going to help me. So take a breath in, and then drop your left shoulder and gently tilt your head to the left. And we're going to do a sustained stretching, isometric stretch, and then let go. And then we'll see how much length we have on the stretch. And then I'm feeling a little bit tighter tension right in here as I'm working on her. And let's do it again. So I'm getting into the front of the neck a little bit and the top of the trapezius. Relax your left shoulder, take a little breath in, and tilt to the left. And then let go. And I'm going to back off on my pressure and then lengthen the muscles by stretching and challenging it comfortably for the patient. I also check to make sure the clavicles are lined up and they move like they need to for breathing ability. Also, the sternum comes into play if there's any kind of whiplash or upper back or mid back pain. And then I look at the rib cage. I see how the rib cage moves, or if it's restricted. I see how it's lined up by looking at both of my thumbs on her rib cage, so to make sure that the front and the back of her body is functioning as well as it could. Now moving into the adjustment phase, I can use the activator instrument, which is a nice gentle instrument. And I can also use my hands. So I have a variety of techniques that will help the patient adjust their joints efficiently, effectively, and of course safely and comfortably. So here's a vertebra that I felt. So I basically, what am I feeling? I'm feeling how the muscles work with the bones and how the vertebrae are aligned or shifted off kilter. So I found a vertebra right there, so I'm going to adjust. I'm going to set her up, and you're going to take a little breath in, and you're going to help me, Janet, and look to the right. There, and that's an adjustment.